Assalamu alaikum. I am Dr. Mohammad Ali Rabbani. Today we are going to discuss the topic of hypothalamus. So our learning objectives for today are that by the end of this lecture you should be able to describe the location and boundaries of the hypothalamus. We will look into it. We will discuss and the different nuclei present in the hypothalamus and what are their functions. And we will explain the main connections of the hypothalamus with the surroundings. Also, we will discuss the clinical problems associated with different lesions, especially these are with the lesions of different nuclei of the hypothalamus. We will discuss with these nuclei. Okay. So, what is hypothalamus? Hypothalamus is a very small part of the brain. It is about 2.3% of the brain in terms of size. But being so small, it has connection with almost all the parts of the brain and not directly, but it's an essential organ for life. It has a numerous function. It has a role in autonomic control. It is the part from where sympathetic and parasympathetic nerves originate. It controls the endocrine functions of almost whole of the body through pituitary. It maintains the temperature and it regulates your hunger and satiety. It regulates your food and water intake, and your emotions and behavior are uh, exhibited physically due to this hypothalamus. For example, when you're angry, your heart rate goes up. This is because of the hypothalamus. And also, hypothalamus is very important in maintaining the circadian rhythm. There are various functions of the body that occur in the rhythm. For example, if you have some diabetic patient or diabetic person in your family, you may know that blood sugar tends to go up in the morning, even though the patient or person has not taken any food through the evening. So this is one of the many examples of the few functions of the body that occur in circadian rhythm and that occur in daily routine, daily rhythm, like biological clockwork. Okay, before going into the detail, we should discuss the location of the hypothalamus, and it will give you a little help and idea in the functioning, and it will help you in the understanding the pictures that will follow. So, for starting, we have not studied higher centers of the brain, so it would be difficult to start from then downwards. We'll start with a structure that is similar to us. So I have chosen the ventricular system. You have not studied ventricular system in detail, but from the introduction of CNS, you know what is ventricular system. It is the series of cavities that contain CSF. So here is the anterior view. You can see that the ventricular system consists of two lateral ventricles. This is right lateral ventricle. This is left lateral ventricle. So these are the ventricles. These are basically first two ventricles, and we don't use the word first two ventricles. We use the word lateral ventricles. So these are connected through this interventricular foramen to the third ventricle. Third ventricle is a single and in midline, and we will have a better view from the side. Okay, let's see here. So the two ventricles, these large lateral ventricles, they are connected to the third ventricle that is present in the midline. Third ventricle is connected through a small duct. This is known as aqueduct of Sylvius. Aqueduct of Sylvius is connected to the fourth ventricle, and fourth ventricle is further downwards connected to the uh, central canal that is formed in the lower part of medulla and spinal cord. Let's correlate it with the you have seen aqueduct of Sylvius and the fourth ventricle and during the cross sections of the brainstem. So let's add brainstem to the picture and cerebellum to the picture and see where the third, fourth ventricles actually lie. So here the brainstem is added. This is the posterior view, and also the cerebellum is added to the picture. So let's rotate it to see from the front view. So here you can see the very familiar picture. You see here the medulla. Here will be the spinal cord. It is connected up to the medulla, and you can see here is the pyramids and the olives, and here is the ponto medullary junction, and here is the pons, and above pons this is the midbrain. Okay, so this is the part you have studied till now. You have studied in DH before going before, when the college was on, and also it has been revised in the lectures in the online classroom. So to view the fourth ventricle, we will remove one half of the brainstem, so we can see in the midline. So I am removing the left part of the brainstem, cerebellum, and the fourth ventricle. So let's view it from the medial side. Okay, here you see that in the medial side, now you see all of these structures in situ, and here is the midbrain again from the inside, and we can see that midbrain contains a cerebral aqueduct of Sylvius in its posterior part, and this is pons. Pons is related posteriorly to the cerebellum. So you can see the upper part of the fourth ventricle between the pons anteriorly and the cerebellum posteriorly. Similarly, from this line onwards, you can see here is medulla, and the upper part of medulla and on its posterior relation has the lower part of fourth ventricle. So you can see the fourth ventricle is present between the pons and medulla anteriorly and cerebellum posteriorly, and the lower part of medulla contains central canal. So this is a quick revision of the structures that you already know and already have studied. So let's make a image of where the thalamus is present and how it relates to the third ventricle. Before moving on to the hypothalamus, let us first remove the brainstem and the cerebellum so that there will be less clutter and it will be easier for us to discuss the topics. So brainstem and cerebellum has been removed, and now we will add thalamus to the model. So as thalamus, right and left thalamus have been added, you can see very well that both the thalami are present on each side of the third ventricle. See, both the thalami are present on each side of the third ventricle, or in other words, you can say that third ventricle is surrounded by two thalami laterally. See, okay, but this is true for most of the third ventricle, but not all of it. You can see here very clearly that this lowermost portion of the thalamus here, and it's the anterior portion of the third ventricle here. So this portion of the third ventricle is not covered by the thalami laterally. So this is the part of the third ventricle that will be covered by hypothalamus. We will see shortly. So before adding the hypothalamus to the picture, let's remove the left thalamus so that we will have a better view of the midline. This 3D model is by Complete Anatomy by Elsevier. I am using this to show you. If you are interested, you can install the program like that. Okay, so this is the hypothalamus has thalamus has been removed from the midline, and um, mm, you can see the right thalamus is present behind the third ventricle, and left thalamus has been removed. We are adding hypothalamus to the picture. So let's add it to the picture. So this is a quick view I am giving you that the lower part of the third ventricle that is not covered by thalamus from each side. So I am adding hypothalamus to the picture. This is the right sided hypothalamus. So the portion that is covered in labeled green is the hypothalamus, and as you can see that it is now covering that part of the third ventricle that was not previously covered by the thalamus. So here you can see that is the part of the hypothalamus. We will get better view after we remove the third ventricle. I'll remove it and show you. So this is the third ventricle. Let's remove it. Okay, the third ventricle has been removed. The whole of the ventricular system is removed. Now look at the ventricular system. So this is the hypothalamus, and you can see this is the hypothalamus. This is present inferior to the it is present inferior to the thalamus, and you can consider it as a cup shape, like you put up your hand during the prayer like a cup. So the your two hands are the two lateral parts of the thalamus, hypothalamus, that are on each side of the third ventricle. The midline where your two hand meets is the midline below the two parts of the hypothalamus meet below the third ventricle, and in front where your finger meets is the part where anteriorly hypothalamus meet in front of the third ventricle. Here is the picture of actual specimen, and here we will see how it is seen. The hypothalamus can be pointed out. So here are the all the this is a cerebral cortex. I'm not going into the detail of the cerebral cortex, and the commissural fiber not going into the details. Here is the part there was third ventricle was present and the thalamus is here. So this is the mammillary body and part of the limbic system and the hypothalamus, and this is the optic chiasm. Optic chiasm is the part where I will show you in the next slide, where the two optic nerves meet, and just above it is the anterior commissure. Here this is the part of the commissural fibers that connects the two hemispheres, and here is the line that hypothalamic sulcus that differentiates the terminal part of the hypothalamus, differentiate the boundary between the hypothalamus and thalamus. So now these are the structures that defines the boundary of the hypothalamus. Let's shade the hypothalamus. So this is the hypothalamus, and you can see the boundaries of the hypothalamus. So it is bounded anteriorly. This is the anterior border. So it is bounded anteriorly by hypothalamic optic chiasm and front up to the anterior commissural fibers. It is bounded superiorly by hypothalamic sulcus that differentiates from the thalamus, and it is bound posteriorly by the mammillary bodies. So the line that connects it all, it demarcates the hypothalamus. Okay. So this is about the hypothalamus. This is a picture from your textbook Neurosnell, and you can see a sagittal section through the brain, and you are seeing the right hemisphere from the left side. So here are all the structures we just saw. Here is the optic chiasm where the two optic nerves meet, and here is the anterior commissure where fibers are connecting the two cerebral hemispheres, and the structure that is present between the anterior commissure and the optic chiasm is known as lamina terminalis. So this is the part that is lamina terminalis found. Here are the mammillary bodies. In the next slide, I will show you the inferior view of the. This is the lamina terminalis, and here is the hypothalamic sulcus. You can see this is the hypothalamic sulcus. So here you can see by the lines you are gradually forming the boundaries of the hypothalamus. So this is the area that is actually bounding the structures of the hypothalamus. Hypothalamus is a gray matter, and it contains different nuclei which will we see shortly. So this is the undersurface of the hypothalamus. In the undersurface of the hypothalamus, you can see this is the part that you already should know. This is the pons, and this is the midbrain. So these are two cerebral crus and crus cerebri, and in between them there is a posterior perforated substance you have studied in the midbrain. So here, from anterior to posterior, if you go, there are three structures. Most anteriorly on the undersurface of the hypothalamus is the optic chiasm. Here you see that here is actually the eyes. If you continue forwards, here is actually the eyeball. So eye, this is optic nerve that comes up to here, and this is left optic nerve, and this is right optic nerve. This is left optic nerve. Before going further, they are to join in the midline. So this part that joins in the midline, this is known as optic chiasm. So we will go about optic chiasm in the detail when we study the topic of the eye. But for now, it is enough for now. So this is in the undersurface of the relation, in the undersurface of the hypothalamus. In most anteriorly, this is optic chiasm. Then there is a swelling in the midline. This is known as tuber cinereum. Tuber cinereum is the swelling in the midline, and from this swelling, a stalk-like structure grows. It is not shown in this picture, but it grows like here and to undersurface, and it ultimately connects with the pituitary gland or hypophysis pituitary. So this is the structure that comes from tuber cinereum. Now the third one is there's two mammillary bodies. They are paired structures and raised on the undersurface of the hypothalamus. So these are two mammary bodies. From anterior to posterior, I will revise again. Anterior to posterior, this is optic chiasm in the front. Then there is tuber cinereum, and then there are two mammillary bodies, and these are actually the boundaries of the hypothalamus. Anteriorly the optic chiasm, and posteriorly the mammary bodies. So this is a picture showing the um, live specimen on all the structures. These are the two optic nerves. They're meeting in the midline to form optic chiasm. This is the tuber cinereum, the raised portion that will give rise to infundibular stalk, and then these are the two mammillary bodies. So this is the whole part of the. This is the structure that is forming the undersurface of the hypothalamus. So before going into the further detail of the hypothalamus is divided we just saw that due to the third ventricle, hypothalamus is divided into two halves. One on the right side, this is the right side of the right hypothalamus, and one on the left side, of the third ventricle. Each side, right and left side, is further divided into two parts, medial and lateral. How it's divided? So here is the picture. It includes the brainstem. This green, it includes the brainstem, all the three parts, and this green portion is the hypothalamus. And added, the thalamus has been removed from this picture, and added in this picture is the limbic system. Limbic system you will study later on in this module, not right now, but you need to just you can see here. I will show you in the different view. So let me get it straight. Okay, that's a good point. Okay, you can see the limbic system has different parts. It has this amygdaloid bodies. This is hippocampus, and from hippocampus there are fibers that go back and curve behind, above, and in front, and it enters into the through the hypothalamus and goes into the mammillary bodies. The same mammillary bodies that we showed watched in the previous slide on the undersurface of the brain. So as the mammillary bodies enter, as these fornix, this is known as fornix. These fibers that are um, entering the hypothalamus. As they enter into hypothalamus, you can see that they divide hypothalamus into two parts. We can see from the point they enter, we can draw an imaginary line from the point they enter parallel in the sagittal plane. So through this point, the hypothalamus is divided into two parts, and this one will be lateral part, and this one will be the medial part, and here will be the third ventricle. From here, there will be the third ventricle. So okay, so this is how the each or half of the hypothalamus is further divided into medial and lateral parts. Okay, let's move on. So this is amygdaloid body and amygdala and hippocampus. So the cursor, and this is the fornix, and this is the mammillary body below showing in this picture. Here, here is a mammillary body showing in the picture. So let's move on. This is a picture from neurosnell. I am not going into much detail, but I just want to show you that this is a coronal section of the brain passing through the hypothalamus. So in the midline there is the third ventricle, and these are all the different nuclei at the different parts of the hypothalamus. But the point I wanted to show you that this fornix. So this is the fornix that is present, and this is the fornix that divides the hypothalamus into two parts. So on the medial side of the fornix, there will be medial part of hypothalamus. On the lateral part of the fornix, there will be lateral part of hypothalamus. So I'm emphasizing on this because this terminology is repeatedly used in the neurosnal, that medial hypothalamus nuclei and lateral hypothalamus nuclei. These are the nuclei that will present lateral to the fornix will be lateral hypothalamic nuclei, and the present here will be the medial hypothalamic nuclei. It does not think that you have to remember so much, but still it will help you read your textbook. So let's discuss the various nuclei of the hypothalamus. I just told you that there are medial part and lateral part, but for the purpose of simplicity, this is a picture for Kaplan. For the purpose of simplicity, I will not go into the which nucleus is on the lateral side and which nucleus is on the medial side. I will just discuss the nuclei as they are present anterior to posteriorly. So they are roughly divided into three regions. This is a picture from Kaplan neuroanatomy. So one is the anterior portion. Here it is labeled as A, and this portion is above the supra optic chasm, and it's above the optic chasm, so it is supraoptic. And then this is middle part. This is known as tuberal part, and then this is posterior part. It is also known as the memory part because it is present above the memory borders. So let's go to the nucleus one by one. Preoptic nuclei. Here is a preoptic nucleus, and preoptic nucleus is present in the lateral part, and it's anatomically not as such as much part of the optic hypothalamus, but it is functionally considered a part of hypothalamus because it's anterior to the this is optic chiasm. The preoptic nucleus is actually anterior to the optic chiasm, so it's not so much considered an anatomical part of hypothalamus, but because it's functionally related, we studied here. And it is I have added a sign of male and female, so it is basically related to the reproduction, and it influences the sex hormone production. It produces, you may know the hormone named gonadotropin releasing hormone, and they act on the pituitary and they result in the release of follicle stimulating hormone and luteinizing hormone. I'm not going to detail all of this. You will study these in endocrinology, in histology and physiology. And it also senses these different hormones like estrogen and progesterone and different hormones, and it responds accordingly. So the next nucleus is suprachiasmatic nucleus. It is present. This is the optic chiasm. It is present just above the optic chiasm. This is suprachiasmatic nucleus. It is present on the medial side of the hypothalamus, and it receives direct input from the retina. The optic nerves that are carrying the sensory input from the retina, some of them leave the optic chiasm, and they leave the optic chiasm and they directly enter this optic retina. So what they do by entering into retina, they help the mm, hypothalamus in keeping track of the time, and they help into maintaining the circadian rhythm. I in the beginning of the lecture I mentioned like your blood sugar level is raised in the morning. Sometimes you wake up without an alarm, so this is the internal clock of the body is maintained. This is one of the component of the internal clock of the body, and this is actually the part that responds to the light. And for example, you have very good example of the circadian rhythm. Like if you have guests from abroad, they have jet lag, they have trouble adjusting their sleep wake sleep cycle for a few days. So this is the part that help it adjust it, and it's further related to signals go to hypothalamus and pineal gland that also maintain the circadian rhythm, but won't go into that. Then there is anterior hypothalamic nucleus. Here it is, anterior hypothalamic nucleus. Anterior hypothalamic nucleus is the air conditioner of the body. It is basically not as such as air conditioner, it is a thermostat. It cools the body when the temperature is high. It acts as a thermostat of the air conditioner. It cools the body when the temperature is high. When the due to some reason the temperature is high, it sends the signal for the sweating and vasodilation from the surface so that heat is lost and temperature drops down. Also, it has very major role in parasympathetic functions. You know all the parasympathetic functions like lower digestion, maturation, and rest and digest. All the things that are related to rest and digest, and lowering of blood pressure, heart rate, and all so and so. So as this is involved in lowering the blood pressure by increasing cooling mechanism, if this does not function, body cannot lower its temperature. If body cannot lower its temperature, of course it will go into a fever. So it lesion leads to hyperthermia, hypermorthermia temperature. It leads to fever. Or there is supraoptic nucleus. Here is the supraoptic nucleus present. It is involved in the production of antidiuretic hormone ADH, or it is also known as vasopressin. Antidiuretic hormone, what it does is it decreases urine production. That is the name indicate antidiuretic. It decreases diuresis, or it decreases urine production. How does it do that? It helps the nephrons to absorb back the um, fluid from the urine into the blood in the collecting tubules, and when it does that, the body amount of urine is reduced and the amount of water consumed in the body is increased. What is it actually has chemoreceptors, or in other words osmoreceptors in it, that continuously check the concentration of the blood flowing around it. If the osmolarity of the blood is high, means the blood is concentrated, it means the water content of blood is low, so it releases antidiuretic hormone that through the kidney conserves water. An important thing to remember is to understand is that here is the supraoptic nucleus. It is also shown here. Supraoptic nucleus produces antidiuretic hormone, but it has axons that extends through the stalk of the pituitary gland to the posterior pituitary. So although the antidiuretic hormone is produced here, but they are released actually in the posterior pituitary by traveling after the supraoptic hypophyseal tract. So from here it is carried on the blood and it is circulated through the body. If there is a lesion of the antidiuretic hormone and it does not work, then you cannot produce antidiuretic hormone, you cannot conserve the water, and you cannot reduce the diuresis. So a person with lesion in hair will have diabetes insipidus, meaning that he will have more than normal amount of urine, for which to compensate he will have to drink more than normal amount of water. Then there is paraventricular nucleus. It is also present in the anterior region here. Paraventricular region, its name indicate it's just adjacent to the third ventricle. It is shown here. It produces oxytocin. There is a long detail of the oxytocin when you go into endocrinology, but we are not going to do that here. It helps in the letting down of milk, meaning that myoepithelial cells present near the nipple helps push out the milk already collected in the lactiferous ducts, and it helps in the uterine contraction during labor. So it has the same mechanism of release, so that it is produced here and it is carried through the supraoptico-hypophyseal tract to the posterior pituitary, where it is released into the inferior hypophyseal through into the capillary plexus of the posterior pituitary. Then there is arcuate nucleus. It is present in the middle zone here in the lower. It is the part where all of the releasing and inhibiting hormones of the pituitary glands are formed. I'm giving you just few examples. For example, the gonadotrophic releasing hormone, growth hormone releasing hormone, and so on and on. There are too many. That is a point, again, the topic for physiology and histology. So these hormones are, but now the important thing to understand here in neuroanatomy is that how does it reaches the anterior pituitary? It does not reaches through the axons like oxytocin or antidiuretic hormone. These are carried through the tuberoinfundibular tract to the hair, tuberum cinereum, and here it is released into the network of capillaries. So this network of capillaries, superior hypophyse, this network of capillaries, they join together to form vein, and this and again it forms a capillary network in the anterior pituitary. So when there is a two capillary systems networks in series, this is known as portal system. So all the releasing and inhibitory hormones that were produced in the arcuate nucleus are released in this capillary system. They are carried by blood into the anterior pituitary, where they act on the different nuclei of the anterior pituitary and causes the releasing or inhibition of different hormones. Then there is ventromedial nucleus. It is present here, and it is actually the satiety center. and it makes you feeling that when you are eating food, it gives you a feeling that you are full and you're happy, and you don't need to add anymore. So this is the center that performs this function, satiety center. It makes you happy because you have eaten food. So it is also sensitive to leptin. It's again topic of physiology, but I will just touch it here. Leptin is a hormone that is produced by lipid cell. If a person is fat, it the in more fat cells, more leptin will be produced, and they will activate this ventromedial nucleus, and theoretically speaking, he should reach satiety earlier. So that is why, if your person, let's say your normal body weight is maintained at a particular weight. For example, my body weight, if my body weight is maintained at 70 kg, I go to vacation with my grandmother, and she feeds me away with tasty foods, and I eat. And in after the holidays, I gained a few kgs. Now the extra fat in my body will release extra leptin and will it increase extra satiety, so that I might not have a feeling of hunger, and I will uh, feel satisfied much earlier than I used to, and it will help me get my weight back to the normal equilibrium that it usually stayed on. So what will happen if this does not function? If this is damaged due to any function, that is like infarct or cancer or anything, if it does not function, then you will never get satisfied while eating food. You will never feel full. The person who has this damage, he will eat and eat and eat and will get fat and will not be get satisfied with the food. Then there is lateral hypothalamic zone. It is not shown in this picture. This it's on present on the later side of the hypothalamus, just lateral to the ventromedial nucleus, and its function is just the opposite. It is the hunger or feeding center. It makes you hungry. When it's active, you want to eat something. And and if it does not function, if it's lesion due to any pathology, it will lead to aphasia. If you will not eat, the person will not eat, he will not feel any hunger. And then there is a dorsomedial nucleus. It is related to, it is adjacent to this lateral hypothalamic zone, and its function is near to it. It's angry nucleus. It makes you angry, it makes you savage. If it's overactive, it will make you aggressive. It is underactive, it will make you passive. So most of the cases, these two nucleus function together. That is why when a person is hungry, he's mostly also angry. कहते हैं ना, चिड़चिड़ हो जाता है जब मतलब भूख लगी होती है. So this is due to the, because when you are hungry, your little hypothalamic zone is active, and it also activates the dorsomedial nucleus that will make you restless, angry, and savage at the same time. And when you are fed and when your stomach is full, and then your ventromedial nucleus will become activated. It will give you a feeling of satiety and it will make you happy. Uh, this was about the this nucleus, and then there is a posterior hypothalamus. Anterior hypothalamus, if you remembered, it was temperature lowering, and this is the exact opposite. This is a picture of a boiler to remember. So it raises the boiler temperature when it is low. So when the temperature is low, it raises the temperature. It will lead to the vasoconstriction of the peripheral blood vessels and will lead to the shivering and thermogenesis. And it also functions with the sympathetic nervous system activity and outflow sympathetic. Then there comes the mammillary body. Here is the mammillary body. It will be discussed in detail in the limbic system, but for now, you just remember that it is related to the feeding and eating behaviors of the body. Subconscious eating and feeding behaviors also, it is related to the short-term memory. It's part of the limbic system. We will discuss in detail there, inshallah. So these are the this is a table from the neurosnell, and these are all the functions and summarized that we just discussed. You can give it a read. Then hypothalamus. So let's discuss the anterior fibers. So here are the medial lemniscus. These are the fibers, you already know the track names. This is the medial lemniscus that carries the discriminative tract, open discrimination, vibration, sense, conscious proprioception. Spinal lemniscus contain crude touch, pain, temperature. Tractus salutatorius that carry taste, And so these are the visceral and somatic sensations. They carry the signals from visceral and somatic structures. And in addition to the thalamus, they also keep the hypothalamus informed. Then there are visual fibers. We saw that in the nuclei. They came from optic chiasm from the retina and directly into the suprachiasmatic nucleus and help in the maintenance of the circadian rhythm. Then there is medial forebrain bundle. It is shown medial forebrain bundle that carries the olfactory fibers, that the sense of smell fibers into the hypothalamic, and then the auditory fibers not shown here in the picture that carries the sense of hearing, and then the cortico-hypothalamic fibers. This is the cortico-hypothalamic fibers. These are the cortico-hypothalamic fiber carrying the information from frontal lobe, frontal cortex to the hypothalamus. So frontal lobe is involved in the conscious thinking, behaviors, emotions, and so for like a person is angry, and now forebrain is angry, and this information will be carried through this tract into the hypothalamus that will lead to a physical response in form of like over sympathetic overdrive. Then there are hippocampal fibers, hippocampal-hypothalamic fibers that we saw in the picture when we saw the in one slide we saw the division of the hypothalamus into medial and lateral parts. So these are the uh, fibers that fornix and that these are the fornix that move from the hippocampus all the way back to the mammillary body, and they are the fibers that divide into the hypothalamus into medial and lateral parts. There are then thalamo-hypothalamic fibers that carrying signal from the thalamus into the hypothalamus, and they're carrying signals from the dorsomedial and midline nuclei of the thalamus. And there are tegmental fibers, and they have the tegmental fibers, and they carry the information from the tegmentum of midbrain to the hypothalamus. Then there are descending fibers in the reticular formation. So these are the fibers that are the sympathetic and parasympathetic. So you saw that anterior nuclei that was lowering the temperature was also parasympathetic, and the posterior nuclei that was raising the temperature was also sympathetic. So anterior with preoptic nucleus, these are sympathetic, and posterior with lateral nuclei of the hypothalamus, they are sympathetic. So they go to the down, and they go down to the respective place. For example, the parasympathetic goes to the cranial nerve number 3, 7, 9, 10, though Edinger vesical nucleus of cranial nerve number 9, and facial nerve, and to the glossopharyngeal and vagus nerve. And also some fibers go down all the way through the spinal cord to the S234 parasympathetic outflow, and the sympathetic fibers go to the from lateral horns in the L1 to T1 to L2. Similarly, there is a mammillothalamic tract. They are the fibers that connect the memory processes to the thalamus, and they connect to the anterior nucleus of the thalamus, and then the mammallo-tegmental tract that connects the mammillary body to the reticular formation in the tegmentum of medulla, and then there are all multiple pathways to the limbic system that will be discussed with the limbic system. So here is the in the spirit of connection, I have shared the picture again, but we have already discussed. Then there is a connection of hypothalamus with pituitary gland. The connection of the hypothalamus with posterior pituitary is direct, like paraventricular nucleus producing oxytocin and supraoptic nucleus producing antidiuretic hormone. They have axons that move through the pituitary stalk all the way to the posterior pituitary. Here they release their hormone, and they go into the capillary bed and the blood circulation. And the anterior pituitary is indirectly connected with the hypophyseal portal system. So the here arcuate nucleus produce releasing inhibitory hormones. They are released here. They are carried. They are released here. They are carried by the capillary system and carried to the next capillary system, the anterior pituitary, where they bathe the cells of the anterior pituitary, and they act. I'm not going to into detail of the pituitary gland, which are the releasing hormone, and which are the hormones released by pituitary. It will be discussed in very much detail in histology and physiology but here the tables mentioned in the neurosnap if you're interested in reading them. So let's revise the functions of the hypothalamus once again. So there was autonomic control through the sympathetic and parasympathetic fibers. The anterior nuclei were involved in parasympathetic activity. Posterior nuclei were involved in sympathetic activity. If you remember that there was lateral nucleus was involved in making you feeling hungry. If you are hungry, you are stressed, you are angry, and stressful condition lead to sympathetic activity. So it's easier to remember that lateral is associated with posterior nucleus. Endocrine control through releasing inhibitory hormones to the pituitary gland. Temperature regulation, anterior one was through parasympathetic activity lowering the temperature when it was high, and posterior region was raising the temperature when temperature was low. There is a regulation of food and water. The lateral region makes you feel hungry and angry, and medial region makes you feel satisfied and happy. And emotion and behavior, there is lateral nucleus that induces rage, and there's also dorsomedial nucleus that induces rage, and there is ventromedial nucleus that induces calmness and passivity. And there's a control of circadian rhythm that was due by the suprachiasmatic nucleus to the retinal fibers. So this was about the hypothalamus. Hope you got something out of this lecture. I'm also uploading this PowerPoint presentation in PDF form, and I'm uploading in addition to this video. Do read this topic from the after listening to this lecture. Do read it from the textbook. You will understand many things more. And if you still have queries, comment under this post. I can answer you. Hopefully, I will answer you when I get time. Thank you. Take care. Allah Hafiz.